In honor of International Day of the Midwife, Friends of Michigan Midwives and the Michigan Midwives Association bring you this series of 3 short videos about Michigan licensed midwives. We hope the videos will help the viewer to understand the LM license and the CPM credential, and how this profession serves Michigan families who choose community birth. This is part 1, all about licensed midwives. Licensed midwives are maternity care providers licensed to practice midwifery. Midwifery is defined as providing maternity care that is consistent with the midwife's training, education, and experience to women and neonates during the antepartum, intrapartum, and postpartum periods. You'll find the authorizing statute for LMs in Part 171 of the Public Health Code, Midwifery. So, are LMs nurses? No, different kind of midwife. LMs and nurse midwives share a similar approach to care, but are 2 separately licensed Michigan healthcare providers. Most nurse midwives practice in hospitals or physician practices. Occasionally, they attend births in homes or birth centers. Michigan LMs, on the other hand, practice exclusively in homes and independent birth centers. They do not receive hospital privileges. Their scope of practice is for the childbearing year only, and they are specially trained in community birth. So where do doulas fit in? Doulas aren't licensed and aren't medical providers. You can think of them more as birth coaches. Confusion between doulas and midwives often occurs because the 2 professions have close associations. We've told you what LMs are not, so now let's turn back to what they are. LMs are certified healthcare providers. Any kind of license is typically based on a certification. In this case, it's the Certified Professional Midwife credential, which includes educational and clinical training requirements that take approximately 3 to 5 years to complete, as well as a 2-day exam. The credential itself includes requirements for continuing education credits and peer review. Of course, like other licensed professions, LMs must pay a licensing fee, periodically renew their licenses, and fulfill other state requirements. Michigan joined the majority of states when it licensed CPMs in 2016. The count of licensed states is now at 36, with a good chance of Illinois becoming 37 very soon. Are you wondering what community birth is? Community birth is a shortcut to refer to birth in a family's home or in an independent birth center. This slide shows an example of 2 Michigan LM practices. One is a Detroit metro area birth center, while the other is a rural northern midwife's home birth practice. Licensed midwives follow the midwife's model of care, which was defined in 1996 by several national midwife and consumer organizations. The model embraces extensive, nurturing, hands-on care before, during, and after birth. Midwives are healthcare professionals specializing in pregnancy and childbirth who develop a trusting relationship with their clients, which results in confident, supported labor and birth. All midwives are trained to provide comprehensive prenatal care and education, guide labor and birth, address complications, and care for newborns. The midwife's model of care has been shown to reduce birth injury, trauma, and cesarean section. This is the end of the first part of our three-part series. Thanks for listening. We hope you will come back for part 2, A History of the Michigan Licensed Midwife.